What I'm going to do, obviously I need to talk briefly about who I am, because many of you might not even have heard of me or know what I actually do. And I'm going to be particularly talking about fathers' mental health today, but those of you already do know me know that I've been sort of working in this field for a long time, and it's not just been about dads. But that's essentially what I'm going to be doing. I want to talk about why it's even important. Now, I know the Fathers Network Scotland covers all things about fathers, so not just mental health, but I want to talk today about why it is important, and particularly talk about what I've been doing in England to try and get a better deal for dads and their mental health, and the success we've had about that, but also about what still needs to be done. And one of the key things you'll see about what needs to be done is the success we've had in England hasn't necessarily transposed into Scotland, and that's just not good enough. So we'll talk about that later on. And I will touch upon COVID. I think there was quite a bit of stuff on the social media that this is all going to be about COVID. It's not. I do want to talk about COVID, but I want to talk about, fathers and their mental health generally, if you like, as well. So just to give you the background, I'm not going to go through all of these because there's just way too many things to explain. But what you can probably see from that is that, I'm involved with a number of local, national, even international organisations on all things perinatal mental health. By perinatal, we mean the period through pregnancy until after the baby's born, and it does mean mums, and it does mean dads, and it does mean same-sex partners. It covers the whole lot. So I've been working with all these organisations. One of the things you might want to grab there, though, and I'm sure we'll be able to share these slides with you later so you can check on my website. But if you want to go on social media and talk about what I'm doing here today, by all means, share this and talk. There's my Twitter there at Dr. Andy Mayers, or Instagram similar. And the other thing that I was going to just mention is, as Chris said at the beginning, please do feel free to pop your anything you want to ask me into the chat. And I think you should, if you don't want to put it on the public chat forum, because you'd rather not do that, you should be able to use the pull down menu just to send it directly to Chris, just in case you want that to be private. But I will do a live Q&A later. So what does that all mean? Well, essentially, with all those things, I've been working with organisations like FNS, but I've been doing it mostly in England, obviously. And that's been about raising awareness, getting that message out there, using the likes of social media to say why this is important, to actually work with the groups to design their services to help them make sure they're safe and appropriate, all that sort of thing. And publicity can go a very long way. I'll explain how it can later on, because we have been using it for some campaigns. We've been actually going to the UK government, I say hesitantly, because it seems to be very England focused even when you get to Parliament, and then obviously there's Scottish MPs there, but it always seems to be English focused. But we have gone into the UK Parliament, we have put our case, and we have had some success. We've also done a lot of awareness through general media, TV, radio, and so forth, newspapers, saying about why this is all important. That's opened so many doors, and I'll show you how later on. And of course, also about the education. I mean, ultimately, I'm a principal academic at Bournemouth University. I teach psychology, but I focus on mental health, and particularly on perinatal mental health. So I tell my students about this. But way beyond that, I train health professionals, I train organisations about what services we need, why we need them, and so forth. So that's about me and what I do, essentially. So why do fathers even matter? Well, I've been working with fathers for maybe 6-7 years, and maternal mental health for considerably longer. But more recently, aspects of my work have focused on some these key areas that you can see there. So essentially, it's working with understanding fathers and working with fathers about what support they need to be able to help their partner should she develop mental health problems, because all too often it's like rabbit in the headlights. So they've got absolutely no idea what to do, what to say, where to get resources, what it even means. So we did some work there. And one of the impacts of that is, of course, it can have a knock-on effect on the father's mental health themselves, although that can develop independently. So we've done some work about fathers' mental health for themselves, what support they get, what support they need, what they need, all those sorts of things. Explain that a bit later on. One of the things I've also done is about fathers who actually witness a traumatic birth. They're in that birthing room when it all kicks off, and yet they get very little support for what they've seen, what it means. And so I'll explain more about that later on. That was another key area. More recently, and this is only just being undertaken now, we're asking dads about their experience of having their child admitted to a neonatal unit. What does that mean, particularly if they've gone back to work? That's new stuff. I won't be able to tell you too much about that, but I will explain some of the other stuff in more detail later on. And, you know, there are many reasons why that's important. I think it's self-explanatory why that's important about their mental health. But you know what? It's not just, this is what's so key about perinatal mental health. It's not just about an individual who may be developing anxiety symptoms, depression symptoms, problems with PTSD, whatever it might be. That's bad enough for an individual to experience. But the difference here is when it affects parents, it's going to affect the partner, it's going to affect the child. And that is really crucial, because if it starts affecting relationships, that can be detrimental to them both. If it starts affecting their baby, their child, as the child develops, then that's important too. We need to be able to do early intervention. I know that's one thing that FNS are really keen to work on, early intervention. So we need to get that support in early. What I will do, and this is a bit of a taster, what I will do is to explain what I have done, then persuaded NHS England, and I stress England there, to actually make a difference, to actually start then screening fathers for their own mental health. But I'm going to leave that there, because that's about one fraction of the story. It really is. And I will talk about whether that's enough. Okay, so the first thing I want to talk about is, you know, this whole thing about supporting the father, about those resources, about understanding how he can help his partner should she develop mental health problems. Why is that important? Well, let's look at the mum herself. What are the risk factors, if you like, about what might make it more likely that she's going to develop things like postnatal depression and that sort of thing? One of the key things here, as highlighted, is not having a supportive partner. Now, that's not a judgment. That's not saying, oh, the father should pull himself together. That's about the fathers largely not understanding what support they can give at that time. So that's what drove me to start doing this work. I know many dads who have seen their partner go through these problems and didn't have a clue what to do. And when they asked for help from health professionals or others, they said, well, why do you need to know? We're supporting the mum here. More about that later on. Okay, so we did some research in that area. And as I said, it's not just about supporting the father to give the mother those resources, because she does need those. But we also know that we don't do that. It could come back on him in any case, and it could affect his developing mental health problems as well. So there's many reasons why that's important. So when we undertook this piece of research, I haven't got time to explain too much about how we went about it, what methods we used. That's perhaps for another day. Well, I think what's really key that we need to talk about is what we actually found. So what we found was that fathers were telling us, when we asked them about those resources that they had or didn't have to support his partner, they were telling us they weren't getting enough information, or if they were getting the information, it was of poor quality. And so it was remiss, they weren't getting any information about the what the mental illnesses were, about how they were diagnosed, how they were caused, how they could be treated, what you could do. What they were also finding was that they wanted to talk to a health professional to say, well, what is this? And they were being dismissed. It was almost like the fathers were being treated as though they were just somebody else in the room who just happened to be the father of the baby. And that's it. Not that they were an integral part, as fathers are these days. So they were missing out on the support, they were missing out on the recognition, they weren't being told about what these diagnoses were and what they could do. And of course, this had an impact on his own mental health, about what services he could access, about the legitimacy of even feeling this way and feeling stigmatized that he should feel this way, when the health professionals were saying, well, you're the father, you know, maybe you should just be the rock here. When it's not as simple as that. So that's what we found, and that influenced us to start educating health professionals accordingly, rattling through these, but it gives you a picture of what we're trying to do. And if you do want to read more about that actual research, it's now published, and when you get these slides, you'll be able to read that actual piece of published research. So what about fathers and their own mental health? Can fathers develop perinatal mental illness? Well, what we do know, the limited evidence that we do know is, yeah, around about 10%, this is an often quoted study, do experience some kind of mental health problem in what we call the perinatal period, but particularly after the baby's been born. And often it depends on what you're asking, who you're asking, how you're diagnosing and all that sort of thing. So maybe it could be as around 4% who are actually experiencing what we might call depression, perhaps. And this is one of the points, is that one of the studies that we saw in Sweden said, actually, the fathers don't really care what is being diagnosed as. They're just feeling this way and they want to know how they can be supported and they can go about seeking that help. So it might not be as important as the actual diagnosis. But what we do know is and in terms of why it's important, is when fathers do show what might be described as potentially postnatal depression symptoms, they are far more likely to be a suicidal risk. That doesn't mean all these fathers can actually do this, but they're more likely to be a suicidal risk than those who are not experiencing those things. So we absolutely need to do this work. And we know that men generally are far less likely to actually ask for help because of the stigma, far less likely to actually seek that support and even get that support, if you like. Now, one of the things I'm often asked, I do these talks, I go on the radio, all sorts of things. They say, well, surely, can dads actually get postnatal depression? Surely that's all about the mums. Well, let's put this in context. Let's look about what maternal postnatal depression is very briefly anyway, because maternal postnatal depression is very, very different to what depression might be in a different population, in a female who's not a mum, if you like. And those are things like, feeling intensely guilty that she shouldn't be feeling this way when she's had a baby, this time of joy and all of that. And she feels even more guilty that she should be feeling that way. She doesn't feel like she's a good enough mum. And then, of course, there's all the complications. Can she have the medication that any other female might have? Will it have an impact on the developing fetus? Will it have an impact on breastfeeding? And then there's breastfeeding itself, and this would take another whole hour to explain about the complications of breastfeeding for mums with mental health problems. But of course, this is something that would be specific to mums that we wouldn't see in a general female population. And then, of course, there's that interaction with the baby. So that's why it's important in mums. So surely it's not the same for dads, though. I mean, one of the questions I'm asked is, fathers can't get postnatal depression because it's hormonal. It's not. Actually, hormones only account for a minuscule amount of the risk factors in postnatal depression in women. It's far more likely to be things like previous history of mental health problems, about the support networks, about education, about poverty, about all sorts of things, and about having a supportive partner. It's the same for dads. It's far more likely to be psychological. Yes, there is some evidence that when a baby is born, the levels of testosterone drop and other factors come in, other hormones come in, and that might open them up to all sorts of emotional feelings he's not seen before. But it's still far more likely to be environmental and psychological, about that transition into fatherhood, about how his relationship with his partner has suddenly changed, about the fact that there's going to be a loss of income over a year, 2 years, or maybe longer, and about the whole thing about stigma, about manning up and you need to be the rock. It is the same for dads, and I don't care what we call it, but yes, fathers can experience these things, so we need to be able to do something about it. Do interventions work? Well, I only want to go through this briefly because we haven't got a lot of time. But even if we identify that fathers need help, even if we start looking at ways that we can reach dad and get them and to encourage them to talk about this and get them to recognize that they need help, how we help them is very different, because what works for mums might not work for dads, and we need to be able to recognize that. We also need to recognize the fact that we need to reach out to dads in a very different way because of that barrier, because of that stigma. So all of those things are really important, and maybe we'll come back to that when we talk later, because I'm acutely aware of time. So what did we find in our research about that? We were finding that fathers weren't even being recognized. Yet again, it's about, well, it doesn't matter that you're feeling that way. It's about the mum. And it's about, maybe you shouldn't be feeling like this right now. And maybe you should man up and be the rock, as I said earlier. It comes into this too. What fathers were also telling us was, try not to paint such a rosy picture during pregnancy about what pregnancy and having a baby is about. Let's manage expectations a bit more to give that reality of what might actually happen, not to scare them, but to give them the toolkits to do something about it when it does happen, or if it does happen. And they were also telling us about the lack of support they were getting. But the key thing here was the mothers were the priority. Now, that doesn't make one, I must stress for all the mums here, all the mums groups are on here, any government that's on here, we're not doing this to take anything away from mums. It's about adding things in that supports the entire family. But the mother is the priority, and the fathers were being told, it was very difficult being a male in a female environment about talking about mental health, about talking about resources, when everything was geared to supporting her and not recognizing that he needs support too. And of course, they were also telling us that it changed them. What a normally confident person was now fearful, was now worried about their emotions, about their feelings, about the way in which they communicated, about suddenly not feeling love. And that could be a symptom of PTSD, many of those things, but you get the idea. The other thing I want to do, and I do feel that, we're rattling through, but I just want to give you a picture of what we're doing. The other thing I did was work with fathers who witnessed birth trauma. Let's put this in context again. First of all, what do we actually mean by birth trauma? Yes, it can mean, major complications. It can mean blood loss. It can mean potential risk to the mother and or the baby. It can mean that. And witnessing that can be very, very difficult for the father. But it doesn't necessarily mean that. It could also be about other things that are going. And in fact, one of the things you might have seen at the beginning, I worked with Make Birth Better, which is essentially a birth trauma network. And it's about what parents consider to be traumatic is far more important than what is actually potentially traumatic, because it can be different for each person. So that's important. It could be far more things than just dramatic outcomes. It could be those unexpected camps. It could be a sudden change in the birth plan. It could be an emergency cesarean. It could be suddenly not being able to have the baby at home and going into the hospital instead. It could be many things. So that's worth remembering when we think about how we support fathers who witness birth trauma. So this is where the difficulty was. What we already know, and that's limited, about mums and birth trauma, tended to focus on the physical outcomes anyway to make sure she was okay. Now, more recently, it has focused on her mental health and coming away from this tendency to say everything's postnatal depression when actually it could be post-traumatic stress disorder as a reaction to the birth trauma. That's what we're seeing with mums. Well, what about dads as well? So what we were finding from Make Birth Better, yes, we know that the data here is essentially telling you about the number of women who experience traumatic births, about those who develop PTSD, and just reiterating what I said about, how we even define birth trauma in the first place. That's important because the fathers are there. They're witnessing this go on. And it doesn't necessarily just mean about the actual traumatic birth itself. Birth trauma can be about complications in pregnancy. Birth trauma can be about IVF planning. Birth trauma can be about having a baby admitted to a neonatal unit. So all these things we need to remember. Let's focus on the fathers. So what we already know then about mums now governs what we need to think about fathers, because we know that generally is going to affect their ability to interact with each other, about the impact on the interaction with a child, about the development of PTSD and all that sort of thing. Now, this is key because let's look very briefly at some of the PTSD risk factors. One of those, if you just look at the diagnostic criteria for post-traumatic stress disorder, it's not just about being involved in an event or being in an accident or what have you. It can be witnessing a traumatic event. We tick that box. It could be a sense of lack of control of the situation. Fathers recognize that immediately. All of a sudden, control's taken away. So kicked out the room, not understanding what's happening, they lose a sense of control. And if that's not supported, they could develop PTSD. About a lack of information that they're getting, I'll explain more about that in a moment, about what's happening, what's likely to happen next, what we can do to support her health, your health, her mental health, your mental health, and about the way in which they're going to process the memories of that event and about how they feel about that. All of these are risk factors, and yet nothing was being done to support fathers to do this. And particularly about coping styles, and I'll be somewhat stereotypical here, but it is true. Coping styles can be positive or negative. Men, sadly, can tend towards the negative coping styles. They're relying on alcohol, they're relying on drugs, they're relying on getting themselves into all sorts of self-harm kind of trouble. That's more likely to happen with men. Another reason why we need to focus on the impact of witnessing birth trauma. So what was my motivation? Well, yes, I've been working in perinatal mental health for many years, and I've been doing some work with fathers for many years. There's professional interest here, there's an academic interest here, but there isn't enough evidence. But often it's personal exposure that can be a great motivator too. When my eldest daughter had her first child over 6 years ago, she would have been pregnant now 7 years ago. So it's about 6.5 years ago when she had a very traumatic birth. Her husband was in that birth room. When my wife was first able to go into the birthing room, not long after the baby was born, and it was traumatic, our son-in-law was stood in the corner of that room, white as a sheet, holding his brand new baby and was shaking. And it immediately occurred to me, what support was he likely to get? We had many conversations, so it was fine. But it occurred to me that we needed to do more support. And then we had the anecdotal evidence, stories that I was hearing of fathers being chucked out of the birthing room the moment it kicked off. Now, I get why we need to support, have the people in the birthing room, making sure mum's going to be okay. They need that room. But to remove the father from the room and tell him nothing, to give him no support, to give him no information, and not even recognise what the impact might be on him or what he can do to support his wife, that wasn't good enough. I even heard one story, I'll tell you now. The father was kicked out of the room once it kicked off. He was sat outside, worried, sick about what was happening. 2 health professionals came out of the room, didn't look around to see who was there. One said to the other, I think we're going to lose them both. What kind of impact would that have on that father? We need better information. So I wanted to do some research. So what did we find? Well, sure enough, fathers were telling us that they had no idea what had been going on. They weren't being told enough about what their partner had just gone through. There was nothing in the antenatal classes of what might happen. There was nothing from the staff about what was happening right now and what they can do about it, or about what the impact will be going forward, physically, mentally, about how that might affect their mental well-being, about their feelings of manhood, because suddenly they're feeling very emotional, or worried about their where suddenly, I'm not happy, I should be happy, but my baby's been born, not realizing that emotional numbing is one of the criteria for PTSD, because they weren't being told. And the impact that had on their relationship with their partner, with their child, and what have you. They were simply telling us they weren't getting the support they need. Again, that work is now published, if you want to read that later. I won't go through the work that we're doing with fathers who've had a child admitted to a neonatal unit, because we're collecting that data right now, but I will report that when we do have that data. So what about NHS England? And I'm sorry I've mentioned that word England there, but there's a reason. We are getting success. Up until 2 to 3 years ago, fathers weren't getting any support anywhere in the UK. It wasn't even mentioned in NICE guidelines. There was no screening of fathers' mental health. We used our evidence. We used the campaigning. We used social media. When I went on Radio 5, not long after that, NHS England came to me and said, okay, we heard you on the radio. Tell us what we need to do to help fathers. And along with other people, we did exactly that. So, as you may know, from November 2018, NHS England said, yes, we will now screen fathers for their mental health. Wow, success. But was that enough? I'll come back to that in a moment. Let's look at that statement now. Again, fathers will now be screened for their mental health. Great news. The other line, where mothers are referred to perinatal mental health services. Oh, is that enough? Well, no, because not all mums are referred or will meet the criteria to go into the perinatal mental health services. The fathers missed. We saw earlier that fathers can develop mental health problems independently of their partner. The fathers are missed. That announcement completely ignored birth trauma. Those fathers are missed. And then, of course, it's only England. Scottish fathers are missed. While we can celebrate what was done, it wasn't enough. And we will carry on campaigning to make sure that's done. I want to give you a little bit more hope in a second. But any hope that we did have, early 2019, it started being rolled out. There was ideas coming through. There was requests from English NHS Trust to undertake, start proposing what they were going to do. They started being developed. Then early 2020, it all went again. And I will talk more about the impact of COVID in a moment. So we need to get this back on track. We need to start saying, okay, enough is enough. We need to be supporting fathers, and we need to be doing it across the whole of the UK. So as I say, we need more campaigning. Okay, so let's just talk about COVID briefly, and I'll give you a little bit more hope. We already know that throughout COVID, for mums, just for mums alone, many of those maternity appointments went online, where we had groups like NCT, the charity support, that all went online, or they were completely cancelled. We also know that after the baby is born, many health visitors were removed from their their maternal role and sent back to traditional nursing to help with COVID. I get that to some extent, but the mothers were being ignored. And then the fathers were being excluded too. You know, many fathers, we hear, and I'm sure many of you can share stories here about fathers being excluded from those appointments, about the initial screening with the sonographer, about other maternity appointments, about about seeing the midwife. You know, they were missing out on that, and many were actually missing the birth itself. So mums were attending these scans alone, and you know, it's at that moment when the mother and the father are in that room seeing their baby for the first time. That's when the bonding starts. That's when the family togetherness starts, and the father's not there to experience that. That's so sad. But it's more than that. You know, a mum could go along to a midwife appointment, whether it's online or otherwise, but particularly if she actually has to go in and see the midwife, and all of a sudden she said, we've just picked up a problem. We've just noticed that there might be some malformation here. The father's not in the room. Not only can he not support her to process that information, he's not there to help her make a decision that might need to be made there and then. And we've heard so many stories of where that's actually happened, and she wasn't even able to call upon her partner to be able to get through what was a devastatingly important moment. So for all those reasons, you know, we need to reinforce that fathers needed to have been there. Yeah, okay, we might be climbing out of COVID now, but we need to learn our lessons from this and make sure this never happens again, because fathers should not have been excluded. Okay, we're nearly there. And there has been some positives, and one of which is that fathers have been at home more to be able to see their child growing up, and that's great. Of course it's great. But there's been many negatives too. Now, I mentioned earlier on, just check this, isn't it? Yeah. Mentioned earlier on about all the support. The eagle-eyed amongst you might have noticed that one of the groups I work with is Best Beginnings. Some of you may know Best Beginnings. Best Beginnings is a wonderful UK charity that supports parents and parents-to-be with a whole series of resources and videos and apps and all sorts of things. And they've done some wonderful work more recently with fathers too. One of the things they do is something called a Baby Buddy app. Some of you might know that. Some mums might have used the Baby Buddy app, and even some dads might have used that. So this is essentially it. The Baby Buddy app is something you can download free to your device and track your developing baby's progress, interact with other parents, get information, get resources to where maybe if there's problems developing, there's mental health resources there. There's all sorts of things. You can create your own avatars and all sorts. There's many, many reasons why Baby Buddy is the Baby Buddy app has been phenomenal. Baby Buddy 1 has been around for a number of years. And actually, I think the last I heard, over the years, around about 20,000 dads have actually used the Baby Buddy app as well. Most of it's been the mums. Baby Buddy 2 is about to be launched. It focuses a great deal more on fathers. And it's currently being developed. We're hoping that it'll be rolled out come April, but there's an opportunity here for you, because one of the things that Best Beginnings want right now is beta testers. And you could, dads who are on this now, and actually, even if you're not your partner's not expecting a child right now, you could do this anyway to experience what the app's like. You could help Best Beginnings to test that, to do beta testing. So there's a link here, which I will post into the chat a bit later on, but you'll be able to get these from the slides in any case. You could, after this talk, sign up, and it really is very straightforward to sign up to beta testing to help them develop this wonderful app of being able to support fathers and mothers through pregnancy and after the baby's been born, physically, mentally, and so forth. The other thing I want to mention, which I haven't got the slides for here, but when I take these slides down, I can link to on my internet browsers if you so wish. Another thing that Best Beginnings told me only today, they hurriedly phoned me yesterday saying, oh God, you're talking to the Fathers Network Scotland tomorrow. We need to tell you about something. They want me to tell you that they've got this resource now where they've got online support for fathers anywhere, and they are particularly keen to hear from fathers in Scotland. When I send you these links, you can click on those links, you can get support immediately online from Best Beginnings to support your mental health at this time when it's obviously it's been really difficult for many of you. So that's hot press news from Best Beginnings. Okay, so where are we now? Final thing I want to tell you about, some of you might already know this, International Father's Mental Health Day. It is the day after Father's Day every year. It's an opportunity to share resources, to promote videos, to have blogs, to have all sorts of things. Mark Williams, who you may know, the Welsh dad who started all this, I've been working with him for many years. We're now working internationally. We're including the likes of November in this. All sorts of things happen. I'd love Fathers Network Scotland to be involved as a centre of International Fathers Mental Health Day. But if any of you on here want to share your story as part of that, let me know and we can do that.